95.7 WCRC, Travis Denning, and after a few. Joining us now, and I do appreciate it so much, we all do, is Dr. Ryan Jennings. And I think we're probably going to talk about common sense and being calm and not panicking and those type of things with the coronavirus and the intelligent things we can do.
That's it, and maybe try to give you a little more updates on what activities we're doing just to make sure that we're prepared and ready in the event that we do see a surge. And I can't thank you guys enough for giving us the opportunity to come on and talk to the community a little bit about those activities. We're very blessed right now, blessed in a lot of ways, not the least of which is so far we have not experienced anyone in the hospital with the virus, and we're really excited to see that. And what that has given us, though, is a luxury of time.
Yes, exactly.
And with that gives us the chance to kind of think about all of those. We always have emergency preparedness plans, and then everything has its nuance. And so we've really been learning a lot as we put provisions in place about how to more strategically implement resources, more incrementally put in resources, so that when something does happen, we've already anticipated it, and that's very much the goal. So in the community, you've seen a lot of stuff from the hospital and surrounding hospitals. I want to really highlight the fact that this isn't us working independently by any means. We've had a tremendous amount of support throughout the community, the emergency response plans, the public health department, the governor's office, information from the CDC. I mean, this is truly a worldwide effort that we have the tremendous ability to be part of in order to keep our local residents safe. But I did want to, make folks aware of some of the things that I think cause uneasiness for the community and really even for our healthcare workers and all of us. And not the least of those is you probably saw we imposed more visitor restrictions, more intense visitor restrictions for the hospital. The reason for that is really twofold. One is to protect our community. So when there is any illness within the building itself, there is the possibility of spread to somebody visiting the building that maybe didn't need to be in the building. It's also because someone in the community can be, relatively asymptomatic, not having any particular symptoms, and come into our building and then expose our healthcare workers or other patients to that. And we're trying very hard to keep our workforce healthy because, if this occurs where we do need to expand our resources in a big way, we got to keep a healthy team to care for those patients and as they arrive.
Exactly.
So I know they're incredibly painful. Yesterday we put in place what we're basically calling a zero visitors policy. It is that, but there are a few exceptions because we do recognize that there are critical times when folks need support people with them. So we've gone ahead and we continue to allow one person to join a woman in labor. So that's a support person for her, and they can select that. Someone that has to have surgery. Obviously, we're not doing a lot of elective surgeries that can be put off into the future. But if someone does need to have some type of surgery urgently, emergently, then we're allowing a support person to be present in the facility for that. Similarly, someone visiting our emergency department, sometimes they need transportation assistance, those types of things. So allowing a single person to accompany a visitor to the hospital. And then end of life is very different. And so, we're handling those types of situations and the very critically ill kind of on a case-by-case basis, coordinating it with the teams, the families. Effingham's and the surrounding area is very, very wonderful because we have very, very large families.
Yes.
And
we do.
That poses even more challenges sometimes when loved ones are not even related to the virus because, all the other stuff is still going on.
That's
and
right.
So
and there is that incubation period, like you said, when people are asymptomatic.
Absolutely.
And they have been exposed and they're carriers, but they have yet to show any symptoms. And they could be very well-meaning trying to come to visit someone and say, well, I'm not sick.
Right.
No, but you could be a carrier at that point. Yeah.
So trying to be very respectful, yet acknowledging the potential risk. Pediatric patients, obviously someone under the age of 18 can have a parent with them. Right now it's a parent with them or guardian, obviously, in those circumstances. And all visitors need to to be over the age of 18 unless they're a parent or a guardian of someone being treated. So that's the kind of the overall rules that we're following. All visitors, though, are being screened at the point of entry, both by questions, just asking, are you feeling well? Have you had respiratory symptoms with a new or a worsening cough? A lot of people, have a baseline. This is my cough.
Yeah.
And
exactly.
know your cough. And,
yeah.
Is that different than it normally is? And if someone has a fever or answers positively to those questions, they won't be allowed to enter the building. They may be asked to wait in the car. And certainly even with loved ones that are able to come in the building that don't require your support unless you're called upon, somebody that's coming in for a test and it's possible to just give your cell phone number and we can call you when that testing is completed and you could come pick your loved one back up. Very reasonable strategies. So we're asking you to be patient. This is hard for you. It's incredibly hard for us. It's circumstances that we hoped we'd never deal with. But right now it's the right thing to do to keep us all safe.
I believe so. It sounds like, as I'm real big on common sense, and these sound like absolutely bottom line common sense. It really does, Ryan. I mean, I know in the healthcare profession it may not sound like that to you, but to we lay people, it does sound like common sense. It all makes sense, exactly what you're doing. And on some of the larger families, like you said, I'm sure it's going to be very difficult on them not to be with the people that they love when they're ill. But if you really love them, this is the best thing you can do, is to stay away from them right now. So
perfectly stated. And we are working on getting some additional like iPads and stuff so we can help families FaceTime, those types of technologies to visit. The same reason that we're trying to reduce the number of visitors is the same reason you're seeing us change our door patterns. So the front door of the hospital has been closed to visitors. All visitors need to be going through the pericardiovascular entrance during the normal hours. So that's 8 to 5 type thing. That's the entrance on the south end of the building that says Prairie. The emergency room entrance is after hours or someone that's seeking emergency care, basically, and women that are presenting in labor, so that we can just whisk them upstairs, basically, and handle it from there. So the common sense piece, is trying to control the number of people, know who's in the building, so that we know how many visitors we have, control those points of entry, so that we're able to check temperatures, those types of things, to make sure that we're not introducing somebody that already is symptomatic and maybe doesn't know it.
Right.
We've seen folks kind of, I'm 101 degrees. I didn't know it.
I had pneumonia one time and went to the doctor to get allergy testing. They checked my temperature. It was 102. I said, I'm fine. And she said, well, I have a feeling you're not going to be in a little while. This was in Effingham. By the time I got to Montrose, I was deathly ill. I had pneumonia. So, I mean, it can, in a matter of literally in a matter of 30 minutes.
So trying to stay ahead of that. Along the stay ahead of it, we talked last time about putting up the triage tent in the front of the emergency department. So there's a small brown tent across the emergency department entrance that at this point is not being utilized. We're very, again, blessed that we're not having that influx, but that'll be used to help triage patients with respiratory symptoms to determine whether or not they need to go to the emergency room. And then this morning, folks, we're seeing, and we had to coordinate with the fire department and those types of things for timing. So unfortunately, a little hard to get ahead of the message because we take our help when we can get it. But we did erect the MABUS tent, which is a disaster preparedness tent. So the fire trucks and the tent are going up in the parking lot in front of the facility. The purpose of that tent really at this point is going to be kind of a wild card. We're going to use it for the possibility of any need for overflow of patient care, maybe for overflow just of patients that have been able to be effectively treated but not able to return to their normal living environment, because not only are we dealing with restrictions on entry to the building and those types of things, our skilled nursing facilities, our nursing homes, our assisted living facilities, our any area where there's what we call congregate living. So those types of things are putting in place restrictions. So there may be folks that leave a group home, maybe unrelated to COVID, but for whatever reason, they're not able to return to that setting. So trying to think ahead, prepare. Let's not have a 5-alarm fire when it happens. Let's make sure that we're thinking through all of those processes well and ahead of time.
So we can put it out with a sprinkler instead.
That's exactly the goal. That's exactly the goal. If I be a firefighter, I want to do it with a watering can, not a hose. We are seeing an influx of calls into our emergency department. So one thing I want to touch on is just, the questions that people have when they're calling. A lot of folks are being very smart and trying to call saying, you know what, I have a cough, I've got a fever, do I need to come to the emergency room? And, that really is a great question. The answer really is, as long as you're not having significant respiratory distress, you're not having chest pain, you just have the typical flu-like kind of illness, you stay home and weather the storm. Touch base, though, with your primary care physician office rather than the emergency department, because they're fielding calls for a lot of other things, for additional instruction. A lot of folks are calling asking about the ability to be tested. And yesterday, actually, the Illinois Department of Public Health did issue kind of a final statement. Well, I shouldn't say final because it changes and it changes
right.
and it changes.
This is in flux.
But because of the limited number of testing supplies, as we work through that, the recommendation now is that only patients being hospitalized, so only if you're coming in and you're sick enough that we're going to actually put you in a hospital, should you be tested, because that helps us to determine, are we going to utilize the rooms that we've now designated on a separate floor with separate air entry and those types of things to isolate you, or can you be returned to home to self-isolate, to take care of yourself at home and do all those things that we should be doing. So if you're looking for testing, that you really are not going to have any just outpatient testing. I went somewhere, I've developed a cough, I've developed a fever, I'm well enough to stay home. The health department will not test for that at this point. The exception being someone that lives in a congregated living environment. So a skilled nursing facility, the nursing homes, the group homes, those type dormitories. I don't know that we have a dormitory here, but those types of settings, those patients can be tested. Otherwise, and that's again just to control, the spread potentially within the facilities, for us to be able to say it is safe for you to return to a facility where you have multiple people. But if you're walking well, walking sick, or however you want to think about that, we will not be testing. The supply just simply isn't available.
No, it isn't.
It may be revisited. A lot of great minds around this. I mean, it's brilliant just seeing the evolution of how the country and the nation and the world are handling this pandemic. And so we anticipate that may become something that we're able to do. But right now, it's not something we can do. Calling the ED and those types of things is just tying up valuable resources right now. So and that's why we're here. That's why we're here to kind of help to get the message out, because I understand people have tremendous anxiety, and appropriately so, but please, we want to be mindful of the work that we're doing. The only one other thing just to touch on briefly, again, not something that we've been affected with specifically locally, but regionally and certainly nationwide, is our blood supply. Coronavirus itself is not something that consumes blood resources per se. I mean, it's not something where you anticipate the need for using blood, but it's resulted in donors that normally would come and donate.
Right, because of the isolation.
Exactly.
Right.
And so there are regions where our blood supply is becoming critically short. So, if you're a blood donor or you want to be a first-time blood donor. You can be a donor or a donor. Either one right now, it would be welcome. We'll take it all.
That's right.
But do look out for some of the area blood drives. Reach out to the blood banks to coordinate a time, because there are limits in how many people can congregate at a time.
Right.
Reach out to them to potentially become a first-time donor. I've seen incredible things happen in our own community and in our world, where folks are gathering together in ways that they never have before. Blood donation is is one of those areas where we always have a critical need.
Yes, we do.
And this is a great opportunity to help steady those reserves and do it safely, again, while we can kind of control how many people are in that environment. So please reach out to your blood banking facilities. So.
Yeah. Back to the testing. This isn't. I'm really glad that you stressed that, because I've been doing some reading on this, and the testing kits they're in short supply.
Yeah.
And it isn't. A lot of people think, I'll just run to the emergency room and they'll do a simple test on me like they do with flu A and flu B. It isn't that simple, folks. It really is not. I mean, you're not just going to go in and have a little nose swab. I mean, that's not what it's all about. This is serious when it comes to having to determine who needs to be tested and who doesn't. So I'm really glad that you hit on that, because I've seen a lot of talk about that.
No, it's and you see some areas where they're doing some more broad testing, but once it's established that it's covering a large region, and you've heard earlier this week that the state was declared an area of regional spread. So basically that means that we know it's out there in various areas.
Not right here, but
So doing testing out in the community to establish whether or not it's there is not as important anymore.
No, we know it is.
Once you know it's there,
as
long as you're able to take care of yourself and isolate yourself from others, the positive and the negative isn't important. It's really when you're coming into the hospital, because it can help us, of course, appropriately isolate. It also helps us to be able to kind of give people an idea, okay, what can we potentially expect in the course of the illness, help family members to understand what they can, expect as the disease progresses. Again, we've been given a blessing of time right now to, I think one of the quotes I saw from a physician was, this is kind of a global deep breath here while we, wait, but take a pause and think about what the potential things that we need to be doing in order to prepare for something that is potentially unprecedented. If everything goes the way we hope it goes, we did a whole bunch of preparation and everything works, and the curve flattens out. Much fewer people get it, and when they do, they're not as sick, and it's spread over a longer period of time so that we have the opportunity to preserve our resources. But if it doesn't go like that, we want to make sure that we've already got 2 steps ahead of the game.
That's right. And by us being one of the later communities that we haven't been hit right here in our immediate area, y'all as healthcare workers in the healthcare field have been able to study what's already been done from the other areas that have been hit so hard. So as you said, time has definitely been on y'all's side.
Yeah, so true. And every day we get new revelations, new things that people have recognized as something that's happened either overseas or in the domestic areas in the United States, of areas that have had higher prevalence, and going, we learned this along the way.
Right.
And we're getting the benefit of that. And the global community of communication around this has been a tremendous resource. And we have lots of folks that are listening to that. Not only, again, we've got the benefit of all of those public resources that I mentioned earlier, and what a tremendous team. We also have our own network of hospitals within HSHS across 2 states, and then even within that we are collaborating with our regional hospitals. So it's just a great big network, and that's how we're going to lick this. It's
right. Everybody pulling together.
Yeah, it's everybody together that's going to make us successful here.
I actually thought of something be a perfect slogan for this, and this is everybody together apart.
Yeah, that's so it's very true. In a kind of a strange way. I've seen so many neat, Facebook people talking to each other and group people singing on balconies, and just things to preserve that idea of social distancing, but still acknowledge that we are human and we seek human interaction.
We do,
and so it's critically important though that we do heed those warnings and be mindful of that distancing, and especially those folks that we know are at the highest risk.
Right.
Being able to help make sure that they have resources in their home and not have to go out in the community.
Exactly. Dr. Jennings, thank you so much, Ryan. I feel funny calling you Dr. Jennings. I've known you so long.
I've been Ryan forever.
I
I've
know,
only been
you
Dr.
have.
Jennings. Well,
I mean,
I can't tell you I've only been Dr. Jennings. I didn't reveal my age. I'm timeless. I'm timeless.
You are.
Like my beauty.
I started thinking the other day, how long have I actually known you? The answer is a little over 17 years now. Wow. Do you believe that?
Well, I can believe it.
Yeah.
I can believe it. My hair went away and yours turned purple. Neither sides of coronavirus.
No, neither one. Well, this is great. And folks, I want to tell you, it's my understanding after talking to Vicki yesterday, you're going to be coming in a couple times a week and keeping us updated, right? That's going to be on Tuesdays and Thursdays, I think, unless your schedule has to change. But we're going to keep people updated so they'll know when to tune in to hear, the latest, get some new ideas if you have new ideas to share with us about this. And I did get a lot of positive comments about your interview the other day. People really appreciated it. So thank you so much for coming in.
No, my pleasure. And again, thank you for WCRC for letting us do it. And,
we're happy to do it.
The schedule may be a little on the fly.
That's right. I can understand that.
But,
you know what? I fly by the seat of my pants, so it don't matter. You show up at the door, knock on the door, and I'll let you in.
Oh, I like that.
Okay.
I like that. Well, again, thank you so much, and please, as you're hearing questions, Gail, keep them, and I'll be happy to try to address them. And we want to keep our public informed and factual.
Okay. Thanks, Ryan.
Thank you.